I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery, and welcome to this video on how to keep your corneal transplant. This is a really important video because I stress it repeatedly to patients who require a corneal transplant, whether it is a full transplant or a layered transplant, such as a stromal transplant, which is the front of the cornea, or a cell transplant, which is the inside of the cornea. It's a really simple concept with what I call the 3 golden rules. The first rule is never rub your eye, ever. I don't care how you do it, why you do it, how you justify it. Rubbing is a subconscious habit which will damage the eye, and certainly it will affect the outcome and longevity of your transplant. So, rule number 1, don't rub your eye, ever. Rule number 2 is always use your drops. Now, when we give you drops, we give them for a reason, not for fun, not to make you pay money, not to support big pharma, but because you need them. Generally, I use antibiotic drops for a very short period of time, often a week, probably at most 2 weeks. And then I use topical steroid drops, which are anti-inflammatory, which you need. Without those steroid drops, I cannot do a transplant. But there's something else with steroid drops, and that is, in certain cases, such as cell transplants or full transplants, steroids increase the longevity of your transplant. That is, if you use them in low doses long term, your transplant will survive longer, which of course is what everyone wants, doctor and patient. Third rule, always attend your appointments. Those appointments are here not for social reasons or a meet and greet. They're really to make sure you're not having problems, because you will not always be aware of problems. Things can start before you are aware. You can have suture related problems, that is when the stitch causes you problems. So those 3 rules, don't rub, use your drops, attend your appointments, are my 3 golden rules. And they're universal, they work. The greatest offenders are young males, but apart from that, most people are pretty good. Now, why do I bring this up? Well, I had a young lady who had a stromal transplant for keratoconus. She was legally blind. I did the transplant several years ago. I gave her my 3 golden rules. She showed up for her first postoperative appointment, and then her next postoperative appointment, and she had around 6/9 vision, which is 1 or 2 lines off 20/20 vision, depending on the chart you use, which is pretty damn good. Very happy patient, very happy doctor. Then she didn't show up. She came back 2 years later, and her cornea had started to scar over. Now, I'm not going to get into what happens. I asked her a simple question. What happened? Why didn't you come in? She looked at me, she shrugged her shoulders and went, "It's personal." Well, I have to say I took that very personally. This is a lot of work that I have put into her eye. This is donor tissue, etc. I said, look, if you want a transplant, please make sure you follow the rules. So I restarted her on drops, and the good news was her vision improved. She came back after a month and her vision was better. That's the benefit of a layered transplant. Then she disappeared. She showed up a year later, and now her transplant had gone completely opaque. Her vision had dropped to worse than her initial vision. I asked her again, why didn't you come in? She looked at me, shrugged her shoulders and says, "It's personal." Well, I could change that transplant and restore her vision, but it's personal to me too. And my question to myself is, why will I waste my time for somebody who doesn't care for the outcome? And the answer is, I've elected not to help her. She can go somewhere else and do the same thing to them, but she's wasted time, effort, resources, donor tissue, eye bank time, staff time, hospital time, nursing time, my time, and skill. There's a whole lot of reasons why people do this. Some people are self-destructive, but it's a good lesson that if you want to keep your transplant, just follow the 3 golden rules. I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.